Okay, so let's get started. Thank you for joining the webinar today. It is called Get AEP Ready, the Medicare Annual Enrollment Period. My name is Tracy Russo-Kesey. I am the president of HTA, and I'm happy to be here with you today. So the first thing that we need to determine is what kind of insurance you have, because depending on what kind of insurance you have, you will have different decisions to make during the annual enrollment period. So two ways that you could potentially be set up. Number one, you may have a Medicare supplement plan along with a standalone prescription drug plan. And if you have a Medicare supplement plan and a standalone prescription drug plan, you will have 3 ID cards in your wallet. You'll have your Medicare A and B card as your primary medical insurance. You'll have your Medicare supplement, otherwise known as Medigap insurance card, as your secondary to your medical insurance. And then you'll have a drug card, which is what you're going to use at the pharmacy. So if you have a Medicare supplement, otherwise known as Medigap, and a standalone prescription drug plan, you're probably carrying around 3 ID cards in your wallet for your medical care. Or you may have a Medicare Advantage plan. Medicare Advantage plans take the place of your Medicare A and B. So although you'll still have a Medicare card, it's probably filed away in your file cabinet. You're just carrying one card around, which is a Medicare Advantage card, and this is for both your medical care as well as your pharmacy benefit. So you're carrying one card, your Medicare Advantage card, which includes your prescription drug plan. Now, if you're looking for more educational details on what these plans are, how they work, deductibles, coverages, anything like that, you can visit any of our informational web pages. We have one for Medicare supplement plans. We have one for Medicare Advantage plans, one for Part D. Part D is also known as prescription drug plans, so think of D for drugs, and one for other coverages, which goes over things like dental, vision, hearing, gym memberships, things along those lines. So we have 4 web pages created to provide you education and short little videos that explain how these things work to really make you feel empowered, like you know what you're doing and what you're talking about. And of course, you have us as a resource as well. Now, I would encourage you, if you're on a Medicare supplement plan and you're thinking about changing to a Medicare Advantage plan, it would be, or vice versa, it would be very important for you to watch the MedSup versus Medicare Advantage differences video. It's a 15-minute video. We have that housed on our Medicare Advantage plans page. That will give you a real good overview of the differences between the 2 types of plans, so you can make an informed decision as to which one may be better for your situation. Now, the annual enrollment period is upon us. What does that mean and who does it impact? So number one, I'm going to start at the bottom here. If you are not yet enrolled in Medicare, or you have Medicare A only, maybe you're still working, you're still on group insurance, this has nothing to do with you. The annual enrollment period is specifically for people that are already enrolled in Medicare A and B, that already have their Medicare secondary insurance, whether that's Medicare Advantage, prescription drug plans, Medicare supplements. This is the time of year where you can change those plans. So again, if you're not yet enrolled in Medicare or you have Medicare A only, this whole webinar has nothing to do with you. You can disconnect now, or you may just want to watch it for your own reference, but it seriously has nothing to do with you. You will have your own special enrollment period when it's time for you to come off of your group insurance or when you turn 65 to get enrolled in Medicare. It has nothing to do with this time of year. So, what types of products are most impacted by this? You have a once-a-year opportunity to either enroll in or change your Medicare Advantage plan or your Medicare prescription drug plan. This is a big time of year for that. So if you're in either one of these type plans, which you're probably in one of them, if you're in a Medicare Advantage, it includes your prescription drug plan. If you're in a Medicare supplement, you need a standalone prescription drug plan. So you're likely impacted by one of your plans, and you would need to or want to address that this time of year. What it does not apply to is Medicare supplement plans. They can be changed throughout the year. And dental and vision insurance, you can get that throughout the year as well. So why is shopping so important this time of year? And again, this impacts your Medicare Advantage and Medicare prescription drug plans. That's because everything about these plans can change. Your premiums can change, Your copays can change. The pharmacies that are covered under your plans, they can change. Deductibles, the drugs that are covered, the services that are covered if you have a Medicare Advantage plan, all of that can change. Even the managed care restrictions. So maybe you have prior authorizations on certain services or prescriptions, or quantity limits on some of your drugs. All of those rules can change for January 1. So Medicare Advantage plans and prescription drug plans are a calendar year contract, and everything about that contract can change on January 1. So it's important, if you're in one of these type plans, even if you're happy, you might want to just at least confirm that nothing major is going to change with it on January 1 before you determine that you are going to keep your plan for next year. Now, Medicare supplement plans, they do not change. The benefits are not a calendar year contract. In fact, the benefits don't change. You have a lifetime contract and your benefits are your benefits. The only thing that changes with Medicare supplement plans is your premium. That can change, typically happens annually, but not necessarily on the first of the year. Many Medicare supplement plans change on your policy anniversary date. So if you originally retired in June, and that's when you did your enrollment, or your 65th birthday was in June, and that's when you did your first enrollment, that's when your Medicare supplement plan is probably going to change premiums, and that's when you would want to address that. So Medicare supplements generally do not need to be addressed this time of year. However, if you are getting a rate increase on your Medicare supplement, November, December, or January, it might be something you just want to look at this time of year as well. Okay, so when can you shop your Medicare supplement plan, since it's not subject to the annual enrollment period? So again, unless you're receiving a rate increase, or maybe you've seen a lot of the Medicare Advantage commercials on TV and you're like, I really think I'd like to try a Medicare Advantage plan instead of my Medicare supplement, that's what you would look at this time of year. But if you like your Medicare supplement plan and maybe you want to look for a better premium for it, but you're content with the plan, I would recommend shopping that outside of the annual enrollment period. You'll have more time to focus on it. Things aren't quite so hectic. The insurance companies are overwhelmed this type of year. The insurance agents are overwhelmed. There'll just be a lot more time and attention to shop it outside of the annual enrollment period. We do a lot of our Medicare supplement shopping in the first quarter of the year. Once everybody has their prescription benefits underway and everything's all organized, we schedule a follow-up call to do your supplement shopping. So you can shop it during this time of year, but if you don't have a specific need and you know you're going to stay with a Medicare supplement plan, but you want to do a review on it, a lot of times it's better to do it outside of the annual enrollment period. But if you think you're going to go into a Medicare Advantage plan, you definitely need to address that now, because again, Medicare Advantage and prescription drug plans are subject to the annual enrollment period. So Medicare supplement plans can change anytime throughout the year. Medicare supplement plans are medically underwritten, meaning you have to be healthy enough. The insurance company is going to ask you medical questions before they take you on as a client. You have to be healthy enough to get approved in order to change your plan or to get a Medicare supplement plan. The only time Medicare supplements are not going to ask you medical questions is if you are within 6 months of either your Part B effective date, Medicare Part B, or within 6 months of your 65th birthday. So if you're first going into Medicare or you're coming off of group health insurance, you can get any Medicare supplement you want for the most part with no medical questions. But outside of this time, if you want to go into Medicare supplement or you want to change your Medicare supplement, you will have medical questions to do so. So what are the important dates that you need to know when it comes to AEP, annual enrollment period? October 1st is typically when they release the plan information for next year. Now, some of you may have already gotten your plan booklets. You may have already gotten letters from certain insurance companies that are making big plan changes. There are at least 1 or 2 insurance companies where premiums are going from the low 20s to the high 70s. Now, don't be worried if you've already received that, because there's lots of other very comparable plans that have premiums in the low 20s. In fact, there's plans next year as low as $6 or $7 a month. So if you get a letter in the mail saying your premium's going from the low 20s to the low 70s, don't get worked up. Just review it during the annual enrollment period and make the change to one of those other selections. So you may have already gotten your plan information, but insurance agents and public information does not get released until 10/1. Now, 10:15 to 12:07, that is the shopping time. That is the time when you can actually make your plan changes. So you can enroll in, for the first time, a Medicare Advantage or a drug plan, or you can change a Medicare Advantage or a drug plan. 12/7 is the deadline to do that. You will not be able to make changes on these type of plans after that date, and all of the changes will be effective on January 1. This is when your new plan will start and your old plan will terminate. Now, there is one other opportunity. It's kind of the catch-all. What happens if I went into a Medicare Advantage plan and I don't really like it? Or what happens if I have a Medicare Advantage plan and I want to go over to a Medicare supplement? You will get one other opportunity in the first of the year to either change your Medicare Advantage plan or disenroll from it altogether and go back to a Medicare supplement, but you will not be able to change prescription drug plans during that time. So if you're in a standalone prescription drug plan, it is very important you address that during the annual enrollment period. Okay, so many people say, well, I'm pretty content with my plan. I don't even want to change. Everything's been working well for me. I'm used to it now. I finally got used to using this card and what the insurance company does and everything. Why do I want to start all over with a new company? That's fine. We have tons of clients that do that. In fact, for simplicity purposes, I recommend it. If you're content with your plan, why change something that's not broke? But let's make sure it's not going to break on January 1. Because like I said, everything with these contracts can change on January 1. So if you're content with your plan and you really don't want to make a change, then what do we need to do? We need to confirm that there's no big premium changes. Most of the premium changes are pretty minimal, but every now and then, like we have a couple carriers this year where the premiums are going from the 20s to the 70s. That's a pretty big deal. But most of them are minimal changes, changing by a couple bucks a month, no big deal. Confirm you're not going to have any big premium changes. Confirm you're not going to have any changes on your current medications. So I'll give you a quick example. My father-in-law a couple years ago, and he knows better now, but he said, Tracy, don't look up my plans for me. I'm happy with my plan. Everything's covered great. I got $5 co-pays on all my meds. Everything's good. Well, I know better than that. I checked his plan behind his back anyway. I mean, he knows I did it. It was okay. He gave me permission. But I said, I'm going to check it for you anyway. And sure enough, 2 of his medications that were $5 in the 1 year, the following year, they were not going to be covered under his plan at all. So they were going from $5 to $130 a piece. That's a big deal. For him, no big, we were able to change him into a plan that covered them all with those low $5 or $10 co-pays again. So, but if he didn't look at it during that annual enrollment time, January 1st would have come, he would have went to the pharmacy and said, what do you mean $130? I just was paying $5 in December. So things like that can happen. They have a formulary list, which is a fancy way of saying what medications do they cover. And that formulary list can change each and every year. So just double checking the meds to make sure they're still covered, double checking the tiers that the meds are listed in, because the tiers determine what copays you're going to be paying. So sometimes your med might be in a tier 1 with a $0 copay, and the following year it could be in a tier 3 for a $47 copay. So just making sure that you're not going to, again, just no big surprises on January 1. We don't want somebody coming on January 1, going to fill a script and have a big surprise and then be stuck with it for the rest of the year. Confirm your pharmacy is still covered. So there's 2 types of pharmacies. There's preferred pharmacies, which offer the lower copays, and there's standard pharmacies, which are still covered, but maybe at a higher copay. And pharmacies networks can change on calendar year contracts. So I'll give you an example. We have one plan this year where the preferred pharmacy is Walmart. And next year, Walmart's not even a covered pharmacy. CVS is the preferred pharmacy. So some people say, oh, no big deal. I'll just switch my pharmacy to CVS. Well, that's great. That's certainly your choice, and you can stay with that plan. But if you say, no, this is a big deal. I like my pharmacist. I want to stay at Walmart. Then that's something that you're going to want to know so you can switch to a plan that does have Walmart as a preferred pharmacy. Check to make sure there's no new restrictions. So there could be prior authorization restrictions, quantity limits on certain medications, step therapy where the the plan makes you try other medications before it'll cover the medication you're on. A lot of the times the restrictions are pretty static from year to year. So if you have prior authorization now, you'll have it next year. But every now and then we'll see a quantity limit that changes and stuff like that. So again, just the theme of this slide is we don't want any big surprises on January 1. Just confirm, confirm, confirm. And then Medicare Advantage. If you are going to go with a Medicare Advantage plan, which are network restricted plans, it does make sense to double check that your doctors take the plan. However, I have a little question mark here because that's not a guarantee. One of the things with Medicare Advantage plans, although it is recommended to make sure your doctors are covered, this is not a guarantee they will remain in network. Doctor contracts can change mid-year and are not locked in for the full calendar year. So it's good to determine that, but again, it's not a guarantee that your doctor will remain in network all year. Lots of the times we have no issues with this. If a doctor's in a network, they stay in a network. But we've had times where doctors, April, we get a memo saying this doctor's no longer accepting this type of insurance. So you either need to find a new doctor or get new insurance, but unfortunately you can't get new insurance on April 1 if you're in a Medicare Advantage plan. So we can do the best we can to confirm the networks and make an assumption that it's going to be good for the whole calendar year, but that may not be a guarantee as an FYI. So if you are content with your plan, you did your confirm, 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 or you had us help you with that, then do nothing. Everything's good, do nothing. You're going to automatically renew into that plan with the new premium and benefits, and you're good to go for next year. But if you do want to change, do you need to cancel your previous insurance? Typically not. Since Medicare Advantage plans and prescription drug plans report to the same CMS system, that's the Center for Medicare and Medicaid Services, that's the same system as Social Security. Everything kind of falls in the same computer system, and they do not allow you to be enrolled in two plans at the same time. So by enrolling in a new plan, the computer system is going to automatically kick you out of your old plan on January 1 when the new plan starts. And during that annual enrollment period, October 15th through December 7th, you can change your mind as many times as you want. You can enroll in one plan on October 15th, another one on November 1st, another one on November 30th, and another one on December 7th. Whatever the last one you enroll in by December 7th, that's the plan that's going to be finalized on January 1. That's the one that's going to take effect. All the other ones will be canceled out. You can only have one plan at the system at a time. The only time you're going to need to manually cancel your other plan is if you cancel your coverage and don't select a new plan. Maybe you just don't want coverage for some reason. Maybe you don't want a drug plan. Or if you're switching from a Medicare supplement to a Medicare Advantage plan. Since Medicare supplements are not government-based insurance, they're private insurance, they don't report to that same computer system. So that would require you to contact your supplement company to cancel. Okay. So let's talk about prescription drug plans as they relate to either Medicare supplement plans or Medicare Advantage plans. If you have a Medicare supplement plan and a prescription drug plan, remember you're carrying around 3 ID cards if this is you. Medicare supplement plans do not come with prescription benefits. That's why you have to have 2 separate ID cards. The good news is you get to choose the plans that are most suitable, the most suitable medical plan and the most suitable prescription plan. They're not connected to each other. So you get to choose whatever works best for you individually or independently. You should enroll in a standalone prescription plan, and enrolling or changing your standalone prescription plan will not impact your Medicare supplement plan in any way, shape, or form. They are 2 completely separate, unique decisions to make. But Medicare Advantage, your Medicare Advantage plan includes prescription drug benefits. So you must take the prescription benefits that come with the Medicare Advantage plan, or you can select a plan that doesn't have prescription benefits if you want, but then you won't have any prescription benefits because you cannot select a Medicare Advantage plan without a prescription card and then get a standalone prescription card. They don't allow that. So you get the Medicare Advantage combined with the prescription benefit, or you get a Medicare Advantage without a prescription benefit, but you can't choose them independently. So if you like the prescription benefits of one plan and the medical benefits of another plan, that's not going to be an option for you. They come inclusive, or you can only get one or the other. If you enroll in a standalone prescription plan, so let's say you pick out your Medicare Advantage plan, you didn't know that you couldn't have a separate prescription plan, so you enroll in a prescription plan thereafter. Remember, there can only be one plan in the system at a time. So by enrolling in that prescription plan, it's going to kick you out of the Medicare Advantage plan for January 1, and then you're not going to have those medical benefits that you thought. You'll be put back in original Medicare. You won't have any secondary insurance because you enrolled in that prescription plan. So just a heads up so you don't make any changes that could hurt you later. Okay, so now let's talk about, you're going to see lots of commercials on TV about Medicare Advantage plans. You don't see as many commercials about Medicare supplement plans. Medicare supplement plans are private insurance. They aren't advertised quite as much as Medicare Advantage plans, which are more government-sponsored insurance. They are advertised very, very heavily. And they say really cool things like low or $0 premiums, free dental benefits, free vision benefits, free gym memberships, free this, free that. You know, sometimes they sound too good to be true, but I'll tell you what, they are getting more and more attractive. But it's very, very important. If you're on a Medicare supplement plan now, and you think, hey, these commercials look too good to be true. I need to look into this. I need to check this out. I might want to move this year. It's very important that you watch our 15-minute video on the differences between the two plans first. You can go to our Medicare Advantage webpage. Again, all the links are here. You can download this webinar if you're watching it live right now. I'm sorry, you can download the PowerPoint if you're watching it live right now, or you can contact us for links to these web pages. But we want you to watch this 15-minute video first because there are some substantial and material differences between these two types of insurance. Medicare supplements are not network-based. Medicare Advantage has network. Medicare supplements are not managed care. Medicare Advantage is managed care. Medicare supplements have higher premiums and lower out-of-pocket costs. Medicare Advantage, lower premiums and higher out-of-pocket costs. The list goes on, and we cover it in detail in a nice 15-minute video that you can watch right on our webpage. So please, please, if you think you want to make the change, watch this video before you make the selection into a Medicare Advantage plan. Because it's easy to go from supplement to Advantage. It's not as easy to go back from Advantage to supplement. And here's why. If you enroll in a Medicare Advantage plan, if you want to change, you simply enroll during the annual enrollment period. This is automatically going to cancel your standalone prescription plan that you had that went with the Medicare supplement plan, because now remember it's all in one included. And once you confirm that you're approved for your Medicare Advantage, you're just going to contact your supplement company and cancel your coverage as of the end of the year, because your Advantage plan is going to start on January 1. Pretty easy, no questions asked. But now let's say you're on a Medicare Advantage plan and you want to go to a supplement plan. This is a little bit trickier. It's trickier with the timing, and it's trickier with acquiring the coverage, because Medicare supplement plans, if you're outside of your initial enrollment period, they are medically underwritten. So what you're going to do is you're going to enroll in your supplement plan. But since it's medically underwritten, you're going to want to wait so you get approved before enrolling in your standalone drug plan, because now that you'll have a supplement, you'll need a separate drug plan. If you enroll in your drug plan before your supplement approval, it's going to kick you out of your existing Medicare Advantage plan for January 1, and you may be left without secondary medical coverage if for some reason you don't pass medical underwriting. So it's very important you know you're approved before enrolling in your drug plan. Once you get confirmation of approval, you'll need to enroll in a drug plan, which will cancel your Advantage for January 1. Since the Part D drug plan must be enrolled before 12/7, you're going to need to start your process as early as possible. October, October, October. If you think you want to do this, let's start it in October. So hopefully we have that approval before December 7th. We get your drug plan in place. You're good to go for January 1. Everything's fantastic. But that doesn't always happen. Insurance companies get backed up. Answers don't come quite as quickly this time of year. So let's say December 7th comes and you still don't have an answer on your supplement. Don't sweat it. You're just going to renew your Medicare Advantage plan for 1/1. And remember, I told you there's that after period, the first quarter of next year. So you'll have a second opportunity to drop or change your Medicare Advantage plan in the first quarter of next year. So let's say you don't get your approval by 12/7 on your supplement. No big deal. We're just going to sit tight We're going to let it keep going. Once we get our approval, we're going to ask to have that effective date on the supplement plan sometime between February 1st and April 1st. And at that point, we'll be able to drop our Medicare Advantage plan and enroll in our standalone drug plan. So as long as we get this process done before March 31st, we're good to go. So if you have a Medicare Advantage plan now, and maybe you're watching this video and it's like November 30th and you're going, oh my gosh, I want to go to a supplement, but I don't have enough time. Don't worry. What we'll do is we'll probably say, hey, just renew your Medicare Advantage plan for 1/1. Let's talk in January. Let's get you enrolled. As long as it's approved by the end of March, we're good. We'll get you off that Advantage plan and into the supplement. Okay. So that talked about a lot of the differences. I know that was a lot of information. This is purely to be educational. We have other resources that are actually going to help you shop. So what are some of the differences for next year that you should be aware of? And of course, we don't have all of this information yet. Some of this information doesn't come out till, late November, December. So we don't have it finalized, but we will be updating our information as soon as it comes out. So things that can change: your Medicare Part B premium. Right now, the standard Medicare Part B premium for 2021 is $148.50 per month. You might be paying more if you're at a higher income. That might go up with a cost of living adjustment. We will put that on our website, on our Medicare A and B page, as soon as it becomes available. You will also get notified by Medicare of your new premium, probably in early December-ish. The Medicare A and B deductibles and copays. Well, these are going to change too, but it's not as important because as long as you have secondary coverage, either Medicare Advantage or supplement, it's not going to impact you too much because Medicare Advantage has their own benefits that you follow. You don't even follow the Medicare A and B benefits. And Medicare supplements are going to pay most of your deductibles and copays. The only deductible that Medicare supplements typically don't pay for you is your Medicare Part B deductible. And this year that's $203. It's probably going to go up by a few dollars next year. Of course, I don't have that information just yet, but it's probably going to go up by a few dollars. So you might have a slight difference in your deductible, but your Medicare supplement should pay all of your other deductibles and copays for you. And again, we will release this information on our Medicare A and B page as soon as it becomes available. Part D, drug plans. If you are taking lots of prescriptions or expensive prescriptions, you probably already know about deductibles and donut holes, otherwise known as a coverage gap. These are probably dirty words to you, and unfortunately, all plans are going to have some kind of deductible and coverage gap situation. The deductibles and coverage gap donut hole information is going up ever so slightly this year. Currently, 2021, it's $445 is the maximum deductible. Next year, it'll be $480 is the maximum deductible. This doesn't apply to all plans, and it doesn't apply to all prescriptions. And when you enter and exit, your donut hole is going to go up a little bit too. So it's going to take you longer to get into your donut hole than it did in 2021. But it's also going to take you longer to come out of it once you go in it, because that threshold is a little bit higher too. And that information is already updated with a short video that explains this in much more detail on our Part D Medicare webpage. And then Medicare Advantage plans, if you're in one of those plans, they typically have a maximum out of pocket that's a bit higher than what you're used to on a supplement. The maximum out of pocket allowed by law in 2021 is $7,550 if you stay with an in-network provider, and $11,300 if you go to an out-of-network provider. That's going to be the same for 2022. So some carriers have lower maximum out of pocket, $6,700, $5,000, $4,500, but many of the plans follow the maximums that they're allowed by law. And this information can be found on our Medicare Advantage webpage, along with videos and explanation. Okay, last thing I want to go over, and then we'll get this all wrapped up, is some of the programs and features that you may hear about, especially on TV commercials. So you're going to see a lot of this advertised: dental and vision, hearing aids, gym memberships, Part B reimbursement, insulin savings programs. These are all things that you're going to hear about, just to give you an idea of where they are and what type of plans include them. So dental and vision benefits, Medicare Advantage plans. Some carriers include limited benefits for this. Network limitations apply, benefit limitations apply. If this is important to you, bring it up, and you can shop your plan based on some of these benefits. Medicare supplement plans, some carriers offer discounts on these benefits as a value-added service, but they don't give true. You can also get standalone dental and vision insurance. You can buy a dental and vision plan. That's going to be the most comprehensive of dental and vision benefits, but of course it comes with its own separate premium, and that you can buy any time of year. Hearing benefits, Medicare Advantage, some carriers include hearing and hearing aid benefits. Copays generally range from about $500 to $1,000 per hearing aid. Medicare supplement plans, some carriers offer discounts on hearing aids, up to 40% off on hearing aids as a value-added discount benefit. It doesn't include true insurance benefits, but you can get discounts by getting hearing aids from certain providers. Gym memberships. Many Medicare Advantage plans are going to include free gym memberships. So if you're a gymaholic, Medicare Advantage could give you free gym memberships. Medicare supplement plans, there are a few limited amount of plans that offer free gym memberships. This was super important to my mom. She goes to the Y and she uses every benefit the Y has to offer: classes, pool, all of it. And so we made sure she wanted a Medicare supplement because she didn't want network restrictions. So we made sure that we got her a Medicare supplement plan that had a gym membership benefit on it. So there are just a few Medicare supplement plans that offer that. Medicare Part B reimbursement. So everybody's got to pay their Medicare Part B premium. It's about $148.50 per month in 2021, possibly a little bit higher for 2022. Medicare Advantage plans, a lot of them advertise this, so you'll see it a lot, that they will reimburse you for your Part B premium, so you don't have to pay them. But in reality, we find that few carriers offer this. So there are some, and you can certainly look at that. Typically, the reimbursements are about $3 a month to about $50 a month. I'm not saying that there couldn't be higher reimbursements available, but typically they're about $3 to $50 a month on your Part B reimbursement. Medicare supplements, they don't offer this. So you would pay your Part B, you would pay your Medicare supplement. And then the last thing, insulin savings program. This is pretty cool. This was introduced by President Trump about a year ago. Not saying anything about his political views or anything. We're not going there. But the program's pretty great for people that take injectable insulin drugs. Injectable insulins, some Medicare Advantage carriers include this benefit, and some standalone prescription drug plans. There's a handful of each. If you take injectable insulins, it would behoove you to get a plan with this benefit, because what's going to happen is when you fill your injectable insulin, it waives the deductible, it waives the donut hole or the coverage gap, and it gives you a flat $35 per month copay on your injectable insulins all year long. So it doesn't cover all injectable insulins, and not all plans have this benefit, but it certainly covers a number of different injectable insulins, and a number of different plans have this. So if you're taking injectable insulins, I would definitely recommend looking at a plan that has an insulin savings program, otherwise known as a senior savings model. So we've gone through the whole AEP, we made our benefit selections. What happens if January 1 comes and you go, oh no, I made a mistake? Well, sometimes we can fix it, sometimes we can't. Part D prescription drug plans, they can only be changed during the annual enrollment period. After December 7th, you're locked in for whatever you chose for the full calendar year of next year. Unfortunately, you will not be able to make a change in the given year, unless you move out of the servicing area or have some other kind of special circumstance that happen. I guess I should put a little asterisk or disclaimer there. But for Most people, you are locked in once you make your decision by December 7th. Medicare Advantage plans, if you're in a Medicare Advantage plan, you will have a second opportunity to change your plan or disenroll from it and go back to original Medicare and a supplement in the first quarter. You cannot add Medicare Advantage during this time if you don't already have it, but you can change it or disenroll from it during the first quarter. Medicare supplement plans and dental vision plans, like I said, this has nothing to do with the annual enrollment period, so you can change this plan any time of year. You can enroll in a new plan any time of year. Supplements are subject to medical underwriting if you're not new to Medicare. Dental and vision, you can change or add any time of year for any reason. So I know that was a lot of information. Thanks for bearing with me. I hope you learned a little bit today, but remember, you're a client of ours. We are here to walk you through this whole process. So in addition to that information I just gave you, don't feel that you're on your own. We can do the shopping for you. You don't have to figure it out. So exclusive for our existing clients, we offer a 45-minute no-cost personal phone consultation. You can simply call our office to schedule the appointment, or you can go to our website, hta-insurance.com/schedule, and you can click on the schedule link and pick out a date and time that's convenient for you to schedule an appointment. On that appointment, we will confirm your medications, we'll research your plan options, and help you make any desired enrollment changes. We fill out all the forms, we send you a link, you go click, 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 and you're done. It's just that easy. We try to help you through the whole process so you don't have to stress about it. Or maybe you say, you know what, I'm pretty content with my plan. I don't need to have a phone call this year. Can you just take a quick peek at it, make sure that I'm not, doing anything that's going to put me in a bad situation? Remember, I was saying if you like your plan, you need to do the confirm, confirm, confirm. Let us do that confirm, confirm, confirm for you. On our scheduling webpage, we have a link to the prescription drug plan review form. If you take 8 or less prescriptions and you're pretty content with your plan, you just want a second set of eyes on it, fill out this review form online, tell us your list of prescriptions. We will go in, we'll check everything, and we'll either send you an email saying your plan looks great, here's all your plan information, do nothing and review and renew, or we'll come back to you and say, there's some things going on with your plan. You may not want to keep it for next year. Let's have a quick phone conversation to review and get you in a better plan. So we can do that for you without you having a phone call. So how do you be prepared for your appointment? If you're going to do a 45-minute phone call with us this year, our time is very limited. We have thousands of clients that need our help this year. So we're asking you to partner with us and be prepared for your call so you can get the most out of your 45 minutes and we can give you the most amount of help as possible. So when you schedule either online or by calling, you're going to get a confirmation email with all of this information in it as well. But let me just give you a heads up. So you want to be ready at your appointment time. We're going to call you twice. We're going to call you at your appointment time and 5 minutes later if you don't answer. So be prepared to look for a phone call from a 610 area code and answer that when we call. So that way you don't lose time on that 45-minute time slot. If you miss your appointment without contacting us in advance, we may not be able to reschedule for you this year. We are getting extremely booked up already early in the season. Be in front of your computer with access to your email. So everything that we're going to do, we're going to email you the plan design so you can look at it with us. If you're making any changes, we're going to email you the enrollment link. So you go click, 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 done, and your change is made. If you don't have a computer, an iPad, a tablet, anything with email access, or even a smartphone that we can text you a link that you can open. We can do it via text as long as you have a smartphone to click on the link and be able to open it up and authorize the signature or look at the plan design. So you'll need to have access to either a smartphone, tablet, or computer for your appointment. If you don't have one, go to a family, friend, neighbor, just get in front of something so we can help you. Have your prescription bottles in front of you because we're going to confirm all that information, very important. If you want to shop your Medicare supplement plan, know your premium and any rate increase information that you may have recently received. Like I said, we don't have to do this during the annual enrollment time. So if it's not of dire need to you, we may say, hey, can we schedule a follow-up appointment in January so we can spend our full 45 minutes today getting your prescription in order, and then we'll do your Medicare supplement in January. If you want to do it all at once, we can do that, but be ready with your rate so we can look it up for you real quick. Now, if you think you want to change from a Medicare supplement to a Medicare Advantage, please, 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 before your phone call, go to our Medicare Advantage webpage and watch that 15-minute video. It's going to go over in detail what the differences are. You don't want to make a change and find out later that you don't like the model of the Medicare Advantage plan. Know what you're going into. Of course, we'll answer any questions you have, but that 15-minute video is going to give you a nice overview of everything so you know what you're getting into and you can decide, is this something I want to talk about during my 45-minute call, or am I pretty content with my supplement and I just want to get my prescription drug plan taken care of? If you do decide you want to change into a Medicare Advantage plan, or maybe you're already in a Medicare Advantage plan and we're shopping it for you, please have your doctors handy for the call. We're going to need to confirm your list of preferred doctors and hospitals so we can make sure that whatever plan you go in, they participate with. You don't want to go in a plan that your doctors don't work with, because that would be no good. So this is how we're asking you to kind of be a good partner for us so we can better help you in the time that we have allotted to shop your plan for you. And again, there's no cost for that phone call. This is an exclusive service for our existing clients. So thank you so much for your time today. I hope you got a lot out of this webinar. I know it may have been overwhelming, but know that the folks at HTA are here and we're happy to help you get through this and hold your hand through the process. So have a great day, and we look forward to talking with you soon.